Good morning, everybody. 7:42 is your time now. The Austin Independent School District is currently doing scoliosis screening on 5th and 8th graders. So what does that mean if your child has been diagnosed with scoliosis? Dr. Matthew Geck is here with the Seat and Spine and Scoliosis Center. Thank you so much for being here this morning.
Thanks for having me.
The school nurses are doing screenings these days for 5th and 8th graders at schools. So if your child does have scoliosis, what does that mean long term for your children?
Well, sure. Just because the school nurse screens you and you come up with a positive screen doesn't yet mean you have scoliosis. The next thing to do is to see your pediatrician or call us, and we'll get an x-ray, and if there is scoliosis, talk about what to do from there. The reason we screen is because we have some treatments that will keep a curve from progressing. Traditionally, that's bracing, but we also have some newer things that we're doing now, too.
And you were mentioning that it's mostly hereditary.
Yes,
yeah.
yes. It runs in families. If your mother or a first-degree relative has, like a sister has it, then your chance of getting it is 10 times greater.
Wow, really? 10 times? Well, we have a picture of an x-ray to show what a curved spine looks like. How old is this particular person?
Yes, this young lady is 11 years old, and
okay.
This is our next line treatment. This is a new innovative treatment where if bracing fails, but the young girl is still skeletally immature, instead of fusing the spine or putting those rods and screws in, we make little 4 or 10 millimeter incisions and put these staples in, and they work like braces. They tether the side of the spine where the curve is and let the rest grow out straight.
Huh. Now, does it have anything to do with your mother always tells you to sit up straight, especially when you're sitting at the table? Does that help improve, if you do have scoliosis, does that help improve your spine?
That doesn't, and I enjoy letting kids off the hook sometimes. If they really have a scoliosis or another spinal deformity, sometimes you see the relief when you say, well, it's not your fault. It's not that you're not sitting up straight. It's that you have this other issue.
And there is another procedure that you guys are doing that we want to show our viewers as well, scoliosis surgery. We can't really see that very well.
Sure.
Yeah,
this is what happens if our bracing fails and someone's not a good candidate for stapling and their curve progresses to more than 50 degrees. Then we worry about long-term effects. And instead of doing a big, long incision with the rods and screws, we now make 3 small incisions, don't really peel the muscles off the spine anymore. We work in the natural intervals and correct the curve that way. And that's what you see there is those 3 smaller incisions.
And quickly, how old should children be before parents consider surgery? Because it seems like it's pretty invasive.
Yes, and I think it's actually complicated because you have to balance how much residual growth is left with how fast the curve is progressing with the kind of curve it is. So that can be a tricky set of decisions to make. But
parents can go and see you and make an appointment there at the Seat and Spine and Scoliosis Center. If you'd like to see Dr. Matthew Geck, you can call him at 324-3580. Thank you so much for being here.